Hello, welcome to this month's Summary Board update. Board meeting took place on the 27th of January at Endeavour House in Ipswich. It was the first meeting in common of both the Norfolk and Waveney ICB and also the Suffolk and North East Essex ICB. It started with the Chief Executive's update. Ed thanked all staff for their work during a busy time, with winter and industrial action having taken place over recent months.
Particular shout out to the Ambulance Trust, who improved their C2 performance by 9 minutes on the year before, and their hear and treat rates were treble what they've historically been, so getting up to 30% hear and treat rates both in Norfolk and Waveney and in SNE. For many years they've kind of hovered around 11%, so just to give you a sense of the step change. And particular shout out to Nicola and colleagues in West Suffolk, excellent UEC performance, so thank you.
Next, more practices across both ICBs are now offering urgent NHS dental appointments. They treat patients with things like severe toothache, broken teeth or displaced fillings that cause pain. Now, over the last 2 years, both ICBs have funded a total of 47 practices to provide extra urgent dental care. And in October, a further 54 practices signed up to the National Urgent Care Incentive Scheme. This is a combined increase of around 38,000 appointments a year. Congratulations were passed to NSFT on achieving a good rating for its forensic services. The Trust was also recognised for the safe and supportive care it provides. Ed applauded the Suffolk Training Hub, which received an award for a £300,000 reduction in spend on agency. This was achieved through the use of a digital platform. The My Care Choices Register, which has been successful in supporting people in North East Essex at end of life, is being rolled out across Norfolk and Suffolk. The initiative is an electronic record of a person's decisions about the kind of care they wish to receive in the future if they become more unwell. The National Lead for the Neighbourhoods Implementation Programme visited North East Essex earlier this month. Dr. Minelle Baki was impressed with the Heart of Grinstead initiative, which is a regeneration of a local community in Colchester. She said it was an example of the community working with local services. Now, in June 2023, 3 people tragically lost their lives in Nottingham following failures in mental health care for Valdo Callacane. He was a patient with severe mental illness. A review body last year highlighted systemic gaps in managing high-risk individuals who disengaged from services. NHS England responded by sending a letter to all ICBs and NHS trusts to review assertive outreach functions requiring updated action plans by last June. Now, at this month's board meeting, members received an update from mental health providers NSFT and EPUT about how the service has further developed. In a moment, we'll hear from consultant Dr. Molly Pillay, but here's Andy Mack, who's the Deputy Chief Operating Officer at NSFT.
There were people in this cohort who perhaps didn't have the allocated care coordinators that we would expect them to have, who have now. We are able to see that they've got care plans in place that are current, of good quality, and we know how many people have got those care plans or where they're missing.
The care coordinators are aware of these patients on their list of patients, to pay that extra attention, to engage with them, to make sure that they engage with the families of those patients, which is another important factor, because what we are very aware is that non-engagement leads to non-adherence of medication, and that leads to relapse, and that leads to the really unfortunate consequences of what happens.
Amanda Lice said 312 applications were received for voluntary redundancy from staff. She also gave members an overview of the feedback received from the 55-day consultation.
We actually received nearly 800 pieces of individual feedback from our current staff across both ICBs. And in addition, we had over 70 pieces of feedback from our wider stakeholders. So a lot of rich feedback that we are currently reviewing. And indeed, that feedback will inform our final structures, which, as our Chief Exec mentioned at the beginning of our board meeting, we will be launching and sharing the outcome of our new structures and next steps with our wider workforce on indeed Friday the 13th of February.
Richard Watson, who's the ICB's Deputy Chief Executive and Executive Director of Strategy, Digital and Commissioning Transformation, gave an overview of what's going well and where further improvements need to be made within both organisations. In his performance update, he said Norfolk has seen an improvement in the 28-day faster cancer diagnostic standard. He added GP services are above plan and that dental provision is in a stronger place. On mental health, Richard said there had been a significant decrease in the number of patients who are out of area for mental health services, which he said was a significant improvement. Here's NSFT's Kath Byford.
We are down to 0 inappropriate out-of-area placements for NSFT across both Norfolk and Suffolk. And for context, in June we were at around 50. So these were 50 people who it was determined should have been cared for in our local beds, but we weren't able to simply because of capacity. So there's a poor experience for the individuals and their families because of travelling challenges for some, but also financially significant because every single person has a day rate and that costs us a lot of Norfolk and Suffolk pounds being lost into the private sector.
Richard also gave an overview of the performance in Suffolk and North East Essex. He said there was improvement at West Suffolk Hospital in relation to the provision of elective care procedures. Richard said there are some improvements with the Ambulance Trust, strong dental activity and GP appointments are above plan. More details in the board paper on the website. The Director of Finance, Howard Martin, gave an overview of the financial position. He said both ICBs are expected to break even this year. Howard also acknowledged the huge pressure that partner organisations had been under over the past year. He then spoke about the 2026 plan.
I'm quietly confident that the ICB will be in a position to put forward a balanced financial plan. We've had some really good progress over the last few weeks with respect to our cost improvement planning. But there's still a really significant amount of work to do and of course a massive amount to deliver, I think, as we go into next year.
Well, that's all from this month's board meeting. The next board meeting will take place on March the 25th at County Hall in Norwich. And for more information and to look back at the recording of the board meeting, please visit the ICB's website.